am Dr. Alasa Mohammed, the founder and the CEO of Solving Medical Conditions. Most of you know me. Yeah, so thank you for joining us. So today, I'll be talking on infertility in men and women. So infertility in men and women. I hope you can see my slide. I hope so. I hope you can see my screen. If you can, just let me know, okay? Can you see my slide?
Yes, we can. We can see your slide, sir.
Great. So let's move on. So infertility in men and women, and let's see what infertility means and how we can help ourselves. So this is the diagram of the male and the female productive organ. Now for the male productive organ, it's what we can see because the male organ is always outside the body, while the female productive organ, you have it most of the vital part are inside the woman. What you just see outside is just the vulva, you understand? But the vagina itself, the cervix, the womb, everything is inside her. So let's get to some definition of infertility because most of us don't know what infertility simply means. So let's just get started. I said infertility is the inability to conceive after having regular unprotected sex. Now there's some words to take care of regular unprotected sex. Not that you just have sex just once or twice. Oh, I'm infertile or she is infertile. No. Then second definition, what infertility is what biological inability of any individual to what contribute to conception. Now when I mean contributing, that means the man has what bring a sperm, then the woman brings her egg, so the woman can conceive. That is having an embryo. You understand? So that's if no party can actually contribute to conception. Then third definition is what infertility is said to occur when a couple, female, have failed to conceive or contributed to conception. Now, for the female, she's not conceiving, while the male is not contributing. Is not contributing to conception after 12 months of regular sexual intercourse without the use of contraceptives. Now, see the period of what 12 months. So you don't just engage in certain intercourse for like a month and there's nothing coming and say, oh, maybe the lady's infertile or infertile. No, that's where at least 12 months of what continuous unprotected sexual intercourse. Now let's move to the next slide. Basic facts about infertility. Now, this fact might be kind of funny, but it's actually true. Okay. Now, 20% of infertility cases comes from the women. 20%. Then 40% of infertility cases comes from the men. This can be funny because we know women, we have this ego and we always feel that, oh, we are the head of the family. So any problem is always the women for this. No. In most cases, the causes of infertility are always coming from the men. You understand? Then 30 to 40% of infertility cases come from both women and men. Okay, so let's let's continue. Then types of infertility. Basically, there are two types of infertility. You have the primary infertility and what the secondary infertility. Now, the primary infertility is this occurs when someone has actually conceived. That's when a woman has actually conceived or contributed to conception. Now, let me just break it down. Why the secondary infertility is when a woman has never conceived or the man have never contributed to conception. Now, there's some cases in which a woman she has been pregnant before, or maybe she lost the pregnancy, or maybe she actually have a child. She want to rest for some time before having the next one. Then when she's ready to have the next one, she's been trying, but it's not coming forth. That you can place that in what? In primary infertility, because she already conceived. Same for the man, maybe he has impregnated the woman before, understand, and he's trying to do it again, but he cannot. That is the case of what? Primary infertility. While the secondary infertility is what the woman has never conceived and the man has never contributed to conception before. Okay. Now, causes of infertility. So now let's go with the women first, because I know women are very special and kind of more complicated. You understand why the men will come to the men later. Okay. Now, causes of infertility in women that's abnormal. So let's see. First, say women have congenital abnormalities which would lead to infertility, include now blockage of the fallopian tube. Now, we know the fallopian tube is what it links to the womb, where which leads to what the release of the eggs. You understand? But the egg have to travel from the fallopian tube into the womb for implantation. You understand? So if the fallopian tube are kind of blocked, the egg would not be able to pass through the womb to implant itself in the womb. It will not be able to pass through the fallopian tube to implant itself in the womb. So that can cause infertility. Then to hormonal imbalance. We know that the female system is made up of hormones, especially when she needs to conceive. You need your estrogen to be on point. Then to maintain pregnancy, you need your progesterone also to be on point. But if you're having this hormonal imbalance, that means maybe you're over-secreting one of the hormones, so you're under-secreting any of these hormones, it can actually affect fertility, can also cause issues for you to conceive. Kindly turn off your microphone, please. Okay, if you're joining us, kindly turn off your microphone. Yeah, thank you very much. Then the next one, what? Absence of reproductive organ. Yes, organ. Now there's some women in which they don't have reproductive organ. You understand? They're like hermaphrodites. Now hermaphrodites are either a man having women reproductive organ, or a woman actually having a male reproductive organ. So there's some women that actually don't have reproductive organ. So they might have their mammary gland, which is a breast, but they might be having penis, or some might even be having vagina, but having high testosterone level, which is making them a man. Understand? So this can actually cause infertility also in women. So let's continue with infertility in women. Then also age, you understand? Now we know women, when they are younger, it is easier to conceive compared to when they are getting old and trying to hit menopause, you understand? Also infection is one of the greatest cause of infertility in women, because the women reproductive organ is very, very, very sensitive. A little infection can actually actually irritate the reproductive organ and cause damage to the reproductive system itself, and which can lead to infertility. Next one, what? Injuries to loss of womb. Now there's some women that have engaged in some kind of operation or some kind of things which might include abortion and other stuff that might affect their womb. Even taking of some kind of drugs also can actually affect your womb, especially some concoction in which they are not prescribed by a medical practitioner. Taking them can actually affect your womb also. So if that can also cause the injuries to the womb, because the womb is like it's the powerhouse of a woman, which actually differentiates a man from woman. So if it's affected, if you have issues, then they can have issues in what conceiving, which can lead to what? Infertility. Then irregular menstruation, amenorrhea. So if you're not having if your menstruation is not coming frequently, it can cause infertility, because for you to conceive, you need to have an egg which is ready to be fertilized. And once you menstruate, it means that your body, your egg is being released. Understand? But if you're not menstruating, that means there was no dropping of the egg for the month, for the past month that will bring the menstruation for this month. You understand? So that is the idea. So if you're not menstruating, that means that your system, your reproductive organ is not, or your fallopian tube is not dropping egg monthly. So that means you cannot conceive. Then that can lead to what? Infertility. Then unavailability of what? Sexual intercourse. Now, sexual intercourse is primary. It's important to conceive. You understand? You need to have sex. The man need to deposit its sperm in you, so you can actually conceive. Then when I mean unavailability, there's some person that they don't have sex just once in a month and you expect to conceive. No, because there's some time in a month in which you are not fertile. You cannot conceive, even if a whole lot of sperm is deposited in you, you might not conceive because you are not fertile in that period. You are not ovulating, you understand? So you need to be ovulating before you can have sexual intercourse. Then we also have what called what regular sexual intercourse. We'll get there when we'll talk about your menstrual, we'll talk about calculating your ovulation period. We'll talk about that very soon. Then lifestyle and diet. Now, what we actually eat, because we are what we eat, because okay, before we go to lifestyle and diet, let's talk about this irregular menstruation. You can see on this chart, this is what the menstrual cycle looks like, you understand? So you can see from the 1st to the 5th day on this chart is what uterine lining breaks down, menstruation occurs. That is when you're actually menstruating. That is when you're actually seeing your blood flow. You're actually menstruating. Now, from the 6th day to the 10th day, the uterine lining thickens again, preparing for ovulation, preparing, but you're not ovulating, you're not preparing. Then from the 11th day to the 18th day, that is when ovulation occurs. Now, if you're having a 28-day ovulation period, it means that if you're having a 28-day menstrual cycle, that means your cycle is 28 days, there's every tendency that your ovulation drops on the 14th. That's half of the period, 14, 15. So from 11th to 18th, that is what your fertile period. That's when you should engage in sexual intercourse to actually conceive. Then from the 19th day to the 18th day, then the egg is being ruptured. Then the womb lining is being ruptured also, because once you are ovulating, your womb tends to prepare itself, thinking it will receive a matured egg. But if a matured egg doesn't, if a fertilized egg doesn't come in, then it's ruptured and the egg also ruptured, and that what leads to what? Your blood flow and everything. Okay, so now let's go to diet and lifestyle. Now, research shows that women who consume 5 alcoholic drinks or less in a week each had lowered fertility. Now, thinking of alcoholic drinks, it shows that if you take alcoholic drinks, everything is what you might have a reduced or lowered fertility. The next one, what? Smoking. Smoking affects each stages of the productive process, including ovum, that is your egg, maturation, and hormone production, which means that smoking also affects your the growth of your egg, because the egg needs the ovum needs to grow, then it has to be matured before it drops off for fertilization. Also on smoking, it also damages the DNA in the ovum, that's the egg, by the action of free radicals. Now, what are free radicals? Free radicals are cancer-causing agents. You get them from your smoke, from your dust, you understand? They are flowing in the system. So these free radicals actually cause damage in the DNA, that is the genetic materials in the egg also. And once those materials are being damaged, the genetic material, then it is nothing. It cannot function, understand? So that's still on smoking also. Women who smoke reaches menopause 2 years earlier than non-smokers. And women who are exposed to secondhand smoke reaches menopause more than a year earlier. Now, say that women that actually smoke gets to menopause 2 years earlier than women that don't smoke, or women that have been exposed to secondhand smoke. Now, secondhand smoke maybe you are always associated, you're always with people that smoke. You understand? You are inhaling what the smoke they are puffed out and inhaling it. Your secondhand inhaler. So you can get menopause a year earlier than normal. Okay, let's move to the next slide. Now, that still on diet and lifestyle. Now, dietary intake also affects the fertility in women, leading to ovulatory disorder, which is the abnormal releasing of ovum or irregular menstruation. Also, women are advised to eat healthy fats, proteins, vegetables, and whole grains. Now, all grains are very good because they help in mopping out excess cholesterol and excess sugar. Also, example of your whole grains are your wheat, you have this basmati rice, your brown rice. Those are your your whole grains are very good. Then more than an hour of vigorous exercise a day can lead to a decrease in the production of hormone that stimulates ovary function. Now, there's a woman that they get they're always exercising, but they're exercising too much, and engaging too much exercise can also decrease the production of the hormones that helps in the stimulation. That is the follicle stimulating hormones for your ovary, understand, to produce a matured egg. Also, this can also help. It can also cause the decrease in production of this hormone. Then let's go to the next slide, and still on diet and lifestyle, because now I'm going to lifestyle. Now, illegal drugs, that is marijuana or marijuana, can slow down the movement of the ovum through the fallopian tube. That means inhaling or taking this drug can actually slow down the movement of the movement of the ovum, that is the egg, through the fallopian tube. Then drugs like cocaine can suppress ovulation altogether by interfering with the feedback loop, which controls the ovarian cycle. Okay, so the next one, let's go to the next cause. That is the next cause of infertility in women, and it's fibroid. Now, Dr. Momorowa talked on fibroid, so I'll just touch it a little and not go deep into it. Okay, now fibroid are abnormal growth that develops in or on a woman's uterus, that is womb. Now, fibroid are more common in obese women. Then it is dependent on estrogen, which is this is the hormone, and progesterone to grow. So they are relevant only during the reproductive years. You understand? So I want to add something on fibroid. Still is this: once a woman has passed childbearing age, the growth, the tumor shrinks and dies. Why? Because it doesn't have what to feed on, because it feeds on the estrogen and progesterone. So when they are not available, because once a woman hits menopause, those hormones are not available. So the hormone, that is the growth, that is the fibroid itself, shrinks and dies off. So let's go into men. Let's see what causes infertility in men. Now, 75% of infertility causes in men, 75% of infertility cases in men is caused by semen, because the semen is what the genetic material, what's needed to contribute to conception. Okay, so now semen-related causes include aspermia, azoospermia, hypospermia, hyperspermia, oligospermia, teratozospermia. Don't worry, I will explain all these spermia, zoospermia. Okay, I'll explain everything to us. Okay, so let's just flow along. Now, then other causes include testicular infection, testicular cancer, ejaculation disorder, chemotherapy, infections, lifestyle, and diet. It is very important, lifestyle, because we are always what we eat. Now, let's go now. Aspermia, simply, this is the complete lack of semen with ejaculation. You understand? Now, once you don't have semen in your ejaculation, you will just have just the fluid, just the fluid, and without semen. That what aspermia. Then you have azoospermia. This is a medical condition of a man not having any measurable level of sperm in his semen. You understand? So they are what they call low sperm count. That's azoospermia, when you don't have measurable level of sperm in your semen. Hypospermia, this occurs when a man has an unusual low ejaculation. That means because in ejaculation you should have at least 2 to 3, you can have millions of sperms during ejaculation. But if you're not having this quantity of sperm, that's when you have what? Hypospermia, you understand? And next one, what? Hyperspermia. This is a condition when a male has an abnormally large ejaculation, you understand? Now, when you are supposed to ejaculate maybe like 3 million, 5 million, ejaculating like 600 million sperms, you understand? So I'm just joking, but when you are actually ejaculating more sperm, you understand, more measurable large quantity of sperm during an ejaculation, that's hyperspermia. The next one, what? Oligospermia. Oligospermia, this is regarded as a low sperm concentration in the semen, you understand, because the semen is the fluid, the liquid is the semen, why the sperm is the material itself, understand? So once you have low sperm concentration in your semen, you have what oligospermia. Then you have teratosospermia. This is a condition characterized with abnormal morphology of sperm. Now, abnormal morphology in which the sperm has defects, understand? Now, if you can see this is a what? This is what how a normal sperm should be. You have head, neck, and the tail, flagella for movement. But when there's some defect can be the head might be too big, or might have two heads, or the tail might be too long, or not having a tail at all, or no neck. You understand? These are sperm defects which can affect which can once your sperm, or once the process sperm is having this defect, it cannot contribute to conception. Understand? Now, effects of infertility. Now, infertility also have effects. Now, what are the effects? First is what? Mistrust. Now, so I've said earlier, I told you that men, we have this ego. Understand? Once after regular sexual intercourse and pregnancy is not coming forth, then the next thing, the woman will say, oh, the woman is the cause. No, the man is the cause. No, you're the cause. And it causes what? Mistrust between the partners. Understand? They don't trust themselves. They start what? Having issues. The next one, what? High blood pressure. Now, how does infertility causes high blood pressure? It's what? Overthinking. When you're not thinking, you're not sleeping, you're not resting because of what? You're concerned with your predicament of not being able to what? Either conceive or contribute to conception. Then what? Anxiety also. You are being tensed. Sorry. When you are being tensed and you just want the result, you just want to have what you want, understand? It can cause anxiety also. Then stress, understand? Stress is what you all know. In fact, we are all stressed up because you have what you call your physical stress and your mental stress. Yeah, physical stress is when you're actually stressed up physically. After doing some physical stuff, you get stressed up. But the mental stress is what is really, really killing you, understand? Because you're always thinking and you're stressed upstairs, you're stressed in your thinking. That can cause depression, and that can also lead to suicide and stuff like that, understand? So these are effects of infertility. Now, how do we prevent infertility? What do we do? How do we prevent infertility? Now, first, you have to be stress-free, because there's some couples that both parties are perfectly okay. They are good after some examination, medical examination. Doctor say, oh, husband, you are fine. Wife, you're fine. But why is conception not taking place? Because what? Is either the man is stressed out or the woman is stressed out. So you have to what? And the best treatment for stress is what? Rest. Regular rest. If you go to a clinic or say, oh, come and buy or come and take this to help you relieve stress, no, most times it just doesn't work out. Understand? You can only help yourself out of stress by what? Give yourself adequate rest. You understand? So you need stress-free. Then what? Eating a balanced diet. Now we've talked about lifestyle and diet. Well, Paul talked about things that you take, that we eat, that actually affect us and affect our ability to perform or ability to contribute or to conceive. We talked about that in lifestyle and diet. And next one, what? Fostering of healthy relationship. Fostering of healthy relationship. Now, you always need someone to talk to. Now, you don't talk to everybody. You understand? You just, when I mean a healthy relationship, there's some person that you need to talk to them. They can what? Give you listening ears. You understand? Not a person that is loose, that wants to finish talking to them, then the whole world, oh, this person is going through this or going through that. You understand? But healthy relationship with someone who can listen to you and give you good advice on how to do stuff. Now, some persons do crazy things when they don't have people to talk to them, or they don't have people to talk to, or they talk to people and the people try to condemn them or try to judge them, judgmental, and that can lead to suicide, lead to depression and all that stuff. So look for what? Foster healthy relationship. They've talked about exercise also. You have to what? Exercise well. Now, there are two differences between exercise and stress. Now, once you're exercising, you are good, you are feeling better, you're feeling good. But when you are stressed, you're feeling bad. You understand? That's the difference between being stressed out and exercising. So you need to exercise yourself well. Try to burn down weight, try to tone down and stay good. Then regular checkup. Regular checkup is very, very important because you need to check your system daily. You need to go to see how for the women especially to see if you're not ovulating, why you're not ovulating, are you having blockage? If you're having blockage, what can I do to open my blockage? For the men, if you're let's say if you're not having enough sperm in your semen, what can I do with the treatment and other stuff? So you need regular checkup. If you don't check yourself up, you just think that, oh, maybe it's the woman, maybe it's the man. You just start assuming, and that will lead to more problem. Understand? So going for regular checkup is important. Okay. So that's the end. I just have to try to be brief because we have spent a lot of time on this section because I have a lot of speakers now. Thank you very much.